It gives the PHA, the Public Health Agency, powers of entry to business. It gives them powers to issue fixed notices. It gives them powers to lay down fines. It gives gives the PHA and other bodies that the Department of Health will deem fit, or the PHA will deem fit, to even prosecute head teachers, principals, if they don't give information over about children who the PHA deem or suspect to be contaminated or unwell. It gives them all of the suite of powers that they had during COVID, only worse. So whilst the COVID vaccine, the vaccine certification scheme coerced young people and other people to take the vaccine, and it prevented them and discriminated against people who didn't. It meant that you had to test every 2 days to go along normal business, to enter premises, which was a nonsense because someone with the vaccine could walk straight into those premises and have COVID and spread it about. So there's no scientific basis for that, but it's bringing in those measures, but not only to coerce people to take a vaccine, but also to mandate them to take a vaccine. And that's probably the most frightening bit about this. But it also requires you to be retained in a hospital, to be removed to a hospital and then to be retained in a hospital or other suitable site, whatever that means. It imposes that you be kept in isolation or quarantine, whatever that means, wherever that would be. Isolated away from your family. And I've asked people to look at this not as black and white words on a piece of paper, but actually think about if their elderly mother or father or their daughter or their grandson happened to test positive for a virus that the government deems dangerous enough. And why I say test positive is because we know that with all of these measures around COVID, that the tests weren't reliable. And there were many people who tested positive that, first of all, had no symptoms, and second of all, didn't have the virus. So the tests weren't perfect. The tests weren't reliable, some people would argue. So if the PHA, the Department of Health, are going to classify people as being contaminated, how are they going to test them? And will that test be reliable? So that's the first thing. It also talks about dead bodies and what the PHA can do with dead bodies. It can isolate dead bodies. It calls them a thing, by the way. But it can also remove dead bodies. And of course, remember, during lockdown, we weren't allowed to attend funerals. We weren't even allowed to stand at the graveside in the open air and mourn with people, our friends, and even some of our wider family. So this is going to be replicated again. But of course, we know the statistics classified at the time that if you died, but you had tested positive, I think, within 28 days of dying, that you were a COVID statistic. You were down as a COVID death. Now, you could have been hit by a bus, you could have died from a gunshot wound, but you were still one of those statistics. So is the government telling me, is the Department of Health telling me now that those people who die of other causes and even other natural causes, that their loved ones won't be able to bury them appropriately, won't be able to see them, and won't be able to be in the same area as them? So some of this is actually quite shocking. And so I really worry that some of this could see the light of day. And so my party, I must say, and I'm very grateful for my party and the way they've supported me over the last number of years. My party has made the decision, it's our position at the minute, that this consultation should be pulled. It should be pulled completely, and that the new minister, because we have a new Minister of Health, Mike Nesbitt, leader of the UUP, and that Mike should look at this from a completely different direction from his predecessor, Robin Swan.